Hi, I'm Naomi Murphy, and this is the Locked Up Living podcast, where we talk with a wide range of people about harsh aspects of institutional life.
We also explore some of the ways to overcome them and to grow and develop. I'm David Jones. So join us every Wednesday morning, 6 o'clock UK time, for a fresh podcast.
So, good to meet you in person, Marianne. So, Marianne Trent is a clinical psychologist who hosts the Aspiring Psychologist podcast, and this year she published a book with Tara Quincherillo, Talking Heads, Your Guide to Finding a Qualified Therapist in the UK, which we thought would be a really useful conversation to hold on the podcast. So, good to meet you, Marianne.
Yeah, and to both of you, thank you so much for inviting me, and it's lovely to see you in person.
So, hi Marianne, it's very nice to meet you. Could we begin, we've just had a little introduction, but could we begin by you telling us some more about yourself and what you do and how you got to this part in your life?
Sure, absolutely. Thanks, David. So, yeah, I'm Dr. Marianne Trent, and as I speak to you now, I'm 43, and I'm a clinical psychologist, which means that I did the NHS-funded route to train as a psychologist in the UK. I qualified in 2011, worked in children and adolescent mental health services for 4 years, then worked with adults in largely, what was a CMHT, but is largely kind of a trauma service really these days. And then sort of did a little bit of both private and NHS practice. I've had a couple of children along the way, and I'm married, all during the course of my life of being a clinical psychologist. And now I work solely in private practice, and I'm passionate about people being able to access or know the difference between qualified psychologists and qualified therapists and regulated ones. And that's something that both myself and Dr. Tara have been speaking about in the media quite a bit as well.
Thank you very much. So I'm going to ask you about your book, because obviously to me it's a fascinating subject, how to find the right therapist. I've been a psychotherapist myself for many years, although I don't practice any longer, but it's been a kind of area that not many people have talked about, and certainly not a great deal of research. So would you like to tell us about your book?
Oh, yes, thank you, I would. So, yeah, Talking Heads, I'll show you it for anyone watching on video. It looks like this. It's got clouds on the front, but it's a really common question that people will often ask me. You know, I would like to look for a therapist for my child or for myself. You know, how do I begin to know where to look, and this person is, for example, calling themselves a therapist, or for example, calling themselves a psychologist. Well, that must mean that they are qualified, right? But you and I know, no, not really. Because in the UK, even anybody who's never done a day's study for therapy or for psychology can legally call themselves a psychologist, legally call themselves a therapist. And for me, that's outrageous as a qualified, regulated psychologist who has worked really, really hard. You're dual registered, I know, Naomi. So you've got both the clinical and the forensic psychologist that you can legally and ethically call yourself. And if you didn't have those qualifications, you could be, action could be taken against you. And for example, David, you're a psychotherapist, or you were. If you called yourself a clinical psychologist or forensic psychologist, you can't do that because they're protected titles. But you could absolutely call yourself a psychologist and nothing would happen. And really the book is for me and Tara to help perpetuate that message, really, that it's okay to ask people about their training, about their experiences, and to normalize the question, who is your regulatory body? Because the real alarming thing is, if somebody is not professionally qualified and doesn't have a regulatory body, if something goes wrong, or if you think that their practice is unethical or unsafe, or something about the treatment that you received made you feel uncomfortable, you have no one to report them to. And that's the worrying thing. You could post on social media, you could try and get media attention, but they could still carry on practicing and perpetuating that harm. And so it's just, the book is a way of guiding people through what the different options are for therapy and for treatment, largely covering private practice, but we do an overview of kind of NHS services as well, just to try to make sense of the websites that you might find when you are looking for how to access help yourself or for someone you care about.
Thank you, that's very helpful. Can you give us some examples of the kind of thing you mean?
Do you mean the harm, or do you mean people practicing without the relevant qualifications?
Well, both. I mean, obviously you don't need to mention names, but some sort of examples of the kind of thing you're meaning.
Yeah, sure. So, anybody, it's really tricky, isn't it? Because we want, as a society, for society to be trauma informed, because our understanding is that actually that is better for us when we're working with people who've endured harm, but also those who have harmed against others. And trauma has a lot to answer for. But if somebody was calling themselves, for example, a trauma-informed therapist, you might think, oh, that's really good. And the same with kind of mental health first aiders. The amount of times I've seen people put on LinkedIn or whatever, I've done my mental health first aid training course and certificate. And, there's such massive engagement. I know you're quite prolific on LinkedIn as well, Naomi, but, people will get hundreds and hundreds of comments saying, well done, that's amazing. And then you and I might say, oh, I've just qualified in this approach, and you get one like and one share, and people believe what they see and don't necessarily know what the meaning behind what they're seeing is. And trauma informed just basically means that you might have read a book on trauma or gone to a 2-hour training event on that, and then you could tout yourself as a trauma-informed therapist, but that doesn't mean that you're getting, I don't know what that was, as a loud bang, that doesn't mean that you're getting evidence-based, robust, ethical, nice guidance-approved treatment, or that someone is going to know how to be able to help you if things get worse. What we're seeing often is people might have a surface level understanding, maybe even something like CBT, cognitive behavioral therapy, that they think that they're able to treat this thing in isolation. But actually, when they realize there's very complex roots to this, and somebody's mental health and safety for themselves and maybe even others begins to unravel, really without the depth of knowledge and experience and hours and hours and hours of patient contact and supervision, it's just not a safe place for people to be in, even with perhaps things that have cropped up for somebody in their life that are not, catastrophic, shall we say. We want people to be able to access the right ethical, qualified, indemnified as well in this modern day and age, accredited therapy, where if something doesn't go to plan, people can be, actioned up or stepped down, so that, or handed to GPs, because those processes, certainly for me as a qualified psychologist, are not alien to me. I'm not going to go, oh, I don't know what to do. Or if I do, I'm going to sit with the client, get them the help until they are safe again. And we don't want people falling between the cracks because they have, done the right thing, tried to access the right help for them at the right time, but it's just been with the wrong person. We don't want people to get burned and lives to get affected.
Yeah, I see what you mean. So you're a great believer in registration and regulation by the sounds of it. But how would someone like me fit in? Because I don't think I've ever been comfortable anywhere, really. I mean, I wasn't hugely comfortable in the field of analytical psychotherapists. but I managed to find a way to work and to work with people. Do you think fitting people into these kind of rigid boxes is the best thing?
For me, I feel like it's a place to start, and then we can look at the people that don't necessarily fit into that. But I would hope that you've had years of training, skills, expertise, supervision that have, been a really rich and rewarding part of your career as a psychotherapist. Are there no professional bodies that you can sign up to voluntarily as a psychotherapist? That would surprise me.
Sorry, is there no?
Are there no voluntary professional bodies or memberships that you can be part of as a psychotherapist, David?
You're talking about my attitude rather than the reality. Yeah, there's loads of things one can join, but I suppose I'm more of a leaver than a joiner. But
yeah, there's probably no one size fits all approach, but this is something we've been speaking about with Radio 4 and with the BBC, Channel 4, to really try and think about the harm that is being caused to people. And it's quite hard to get people to talk about that because of the ethics of obviously sharing people's deeply personal mental health stories. And so it's not an easy thing to get airtime to, really. There's maybe no ideal solution other than possibly more societies, more organizations that do look out for people that are falling between the cracks to say, actually, David is qualified, he is experienced in this, you are going to be in safe hands, and if something goes wrong, here are the processes. I think we all need to get better at that. If you don't like the care and treatment that you receive, this is how you can take this forwards. Because people acting in isolation or even as part of organizations, sometimes people will find you a therapist, match you up with a therapist, but there's not actually been that much research done into the people that are available to choose from.
Thank you. So do you think that a bachelor's degree in psychology doesn't quite prepare you for being a psychologist then?
It really doesn't. And it's I don't know, for me, the very idea that I would have done my undergraduate degree and then suddenly been like, that's it, like, I'm going to go on TV now. Like, I'm a psychologist. I'm going to convincingly sit on sofas and talk about that. I couldn't have done it. My imposter syndrome, even now, as a clinical psychologist, I've been qualified since 2011. The imposter syndrome still takes hold at times. What people may not realize, so you may even think, they've done a psychology degree. Of course, that's fine. What people don't realize is that a psychology degree usually doesn't include any client interaction, doesn't include any therapeutic skills really, other than maybe what they are, but you're not practicing them. You're not honing your craft. You're maybe learning about different therapeutic approaches, different ways of treating people, different psychopathologies for people's mental unwellness. You're maybe dabbling in a little bit of research as part of your dissertation, but you are not doing bums on seats, clinical hours. That is not what a psychology degree was aimed to do. It was aimed to give people an oversight of what it is to be human, and to then, if they're interested and they've done reasonably well, to take the next steps to pursue a professional qualification or more specialist training. It was never the intention that you'd go into private practice straight away from an undergraduate degree.
Thank you.
So, Marianne, by virtue, in order to sort of give a bit of context, I wondered, I was just reminded of one of the blogs that you created about how much experience you had from the point of doing your psychology degree to the point of being qualified. And I wondered if you could talk us through that as a bit of an example in terms of, what is the difference between somebody who's just graduated from university with a BSc in psychology and somebody who's qualified as a clinical psychologist, for instance? And obviously there are different routes of qualification.
Yeah, I guess it's also worth saying that no two graduates are the same. You might get somebody who graduates at age 21, you might get someone who graduates at age 49, and of course their life experience is going to be very different. So I will talk to my experiences, but I went to university at age 18. When I was 19, I started working for student services, working with students with disabilities or fleeting disabilities like broken arms that meant that they couldn't take notes in lectures, or broken legs or whatever, to help them to be able to engage fully with their education. I've also been a home carer during my degree, and when I graduated in 2002, I then did various different non-relevant roles, but ultimately was doing home care and worked for Milton Keynes Council. That's originally the area where I'm from, for 2.5 years, working with people with physical health disabilities, trying to look at their rehab potential to be able to live independently, and learning a great deal about working with people with acquired brain injury, working with people with kind of conditions they've been born with, but also muscular dystrophy, multiple sclerosis, all manner of difficulties. And then working with older adults as an assistant psychologist in a forensic inpatient hospital, working across 3 very different wards, but learning my skills in neuropsychology, which is kind of the assessment of people, but also in looking at risk and managing risk and reducing risk. Working out, what is depression? What is anxiety? What is psychosis? What does psychosis look like when it's well managed? What does it look like when it is not well managed? What does it look like when people are, heading towards rehab potential and their risk is developing or increasing or decreasing? Really learning my craft, but also looking at patterns of behavior and monitoring and kind of staff training and working around patients and service user needs to really think about complex issues around splitting and psychopathology and whether people are being consistent and honest and genuine, and going to tribunals for kind of people's leave, like really loads of stuff. And then from there I went to working in a youth prison. Then from there I was fortunate enough to get a training place for 3 years on the professional doctorate. I also was doing voluntary work for the Brownies, like working, really important for me to see children in a normal cross-sectional environment, as well as, in youth prisons and mental health services. But then as part of that training, 3 years, I did 6 different placements across the lifespan, including people with intellectual disabilities, older adults, assessing and diagnosing for dementia and various different kind of, whatever comes up in life during those 3 years, I was there, and as part of that had to do my doctoral thesis. I also did 1 year of masters as well before I did that. So really from the point where I started my undergraduate degree, that was 1999, the point where I qualified, with a little bit of life thrown in, I did go backpacking and have some nice adventures. That was 2011. So many years, really. And even after I qualified, still very interested in enrichment and CPD. I'm currently listening to a book on kind of children and parenting, and looking at all the research in how to try and do that better, and to help the clients that we work with really common questions that they have around kind of respect and not losing our children to their peers, and trying to be a positive role model. I care passionately about wellness and well-being. I'm the sort of person that doesn't necessarily have surface level conversations, but I love a deep one. And yeah, this is just, it's part of me. I wonder what retirement will be like, because it feels like it's so interwoven in what I do. I don't know if I've really answered your question, but there's been a lot of experience, really.
Well, I think you could hear from your answer, Marianne, that it isn't as simple as going and doing a 3-year course and then being qualified, but actually there's a whole host of different experiences that would contribute to you in getting on a clinical psychology training course in the first place, because it's highly competitive to get on, and so needing those experiences to really be the kind of person who's going to be selected for training. So we're talking about very many years of learning, not
It's
just
also
a
those
degree.
touch points, though, isn't it, Naomi? It's all those supervisors I've met along the way, and all of the people that have had to rubber stamp to say, yes, you've passed that placement, or yes, I'll support you in your application for this new assistant job, for this new training, doctorate that you want to do, and coming out the other side with the really rigorous viva as well that you have to say, yes, you are of the standard, even your written work, the way that you talk to clients about themselves, or if you're talking to professionals about them, is respectful and safe, and you're using evidence-based ways of understanding that person, and we think that you're safe to operate, and we're happy for you to then go on and register with the HCPC, the Healthcare Professions Council, as a practitioner psychologist, and we will be your regulatory body because we believe everybody that's said that about you. So you kind of get the green light to proceed. Sorry to speak over you, Naomi, but it feels like that's really important as well.
Absolutely. So I think that's fine to speak over me. You might want to put off the next question, which is the one about what's the difference between a psychiatrist, an applied psychologist, and a psychotherapist, and does this matter if you're looking for therapy?
It matters if you're looking for different types of therapy. So psychiatrists and psychologists is a really common question to be like, well, I don't really know the difference. But psychiatrists in the UK certainly they'll have a medical degree first. So they might well have done all of their medical training, and then they specialise in psychiatry, which would then mean that they're able to diagnose, understand, treat in theory, and prescribe medication to alleviate common mental health presentations. That might be psychosis. It might be prescribing antipsychotics. It might even be prescribing talking therapies. And certainly when I was a trainee, I actually supervised psychiatrists in learning their trade with different evidence-based therapies. So in truth, psychiatrists can do talking therapy, but largely speaking, they often tend not to. But yes, you typically find them often in medical-led services, looking at reducing risk to self and others, often using medication. Psychotherapists are people who are mental health informed, and I think I'm right in saying, David, are often psychodynamic in orientation, but probably not exclusively. You might want to talk to the difference for psychotherapists, but psychologists, I mean, I think is there 8 or 9 breeds of us, Naomi? So forensic,
Something
clinical,
like that.
counselling, education and child, sport and exercise, and they're all the UK. I think there's 8 or 9. They're all the UK HCPC practitioner psychologist titles, and obviously there is a difference between, for example, a sport and exercise psychologist and a forensic psychologist. I won't talk too much towards the difference of that, but the similarities between them are that you are having to do your assignments, you're having to be rigorously assessed, passing milestones, and then ultimately registering with the HCPC, continuing to renew that every year, and of course having the relevant indemnity insurances in place to practice. But also when we yearly sign up to our renewal, we're saying that we're doing our CPD, and that of course we can be CPD audited as well. And we are saying that we are following the nice guidance, for example, for the different treatment and understanding of different presentations. So I feel like I've not given a very good example about psychotherapists, but I'd throw that question over to you, David. How does that differ?
Well, you've raised an interesting question, really, because years ago, round about when I first started thinking of being a psychotherapist, every psychotherapist was a psychodynamic psychotherapist, and they thought they kind of owned the title. And then there was a bit of an argument. I can remember reading about it in journals as psychologists wanted to be called psychotherapists as well. And now, of course, virtually anyone refers to themselves as a psychotherapist, and there are different brands and types of psychotherapy and or counselling as well. So it's a very broad field.
Yeah, and psychotherapist is another title that you could literally just you call yourself that, and therapist as well. But I think where this really is an issue is because the UK public believe psychotherapist and therapist and psychologist mean something, and actually what we know is it could mean nothing. So it's just to really ask the questions.
So does your book provide readers with the kind of questions that they could take? Because I think most therapists offer kind of a free consultation to be able to have a sense of who they are as a person. Does your book offer some advice of the kind of questions that people could ask?
Yes, indeed, it does. It really empowers people to know the questions to ask, but also to know that it's okay to ask them. If someone was looking at engaging your services either for themselves or the organisation they work with, Naomi, there's no way that you'd be insulted if somebody said, can I ask about your experiences, or can I ask about, who your professional regulatory body is? The people that have got that are I'd be pleased if somebody said that, because I think, oh, excellent. I'm happy to demonstrate that. I'm happy to show you the link to how to check. So for the different regulatory bodies, there is details of how to go on to the relevant registers in the book to check that out for yourself. And it's not, I know we're not always in UK society that great at being assertive or asking questions, but it's knowing that that's okay to do. Your mental health, your well-being, your treatment really matters, and you should be empowered to feel like you're able to make safe choices.
Thank you. David?
All right. Where have we got to, Naomi? You sped through those questions very quickly. So it's interesting. We were talking about different types of therapy and different kinds of psychotherapy. How does the regulation of psychologists compare to the regulation of other bodies, other talking therapies?
We've got the HCPC, so the Healthcare Professions Council, and they will be the professional regulatory body for qualified practitioner psychologists, but also random things like paramedics. It's a broad service there, but obviously they wouldn't be practitioner psychologists for that, but they are the Healthcare Professions Council. Then there's it's a bit unfortunate that we've got the BACP and the BABCP. It's very, very similar, but CBT therapists, for example, would need to be registered with, I think, the BABCP, whereas counsellors would be BACP. I hope I've got that the right way around. But and some of those would be signing up voluntarily, but certain qualifications mean that you need to register with those in a compulsory way. And then to throw kind of some extra fun and games into the works, British Psychological Society, so BPS, did used to be our professional body before the HCPC took it on. And so you might well have registration with the BPS. You might have graduate registration and then still be able to use the BPS logo, which might make you look like you're being endorsed by the BPS or that you are more qualified than you are. And again, you wouldn't necessarily know what chartered meant. So I'm a chartered psychologist with the British Psychological Society, but that makes me no more or less qualified than if I chose to register with them. I register with them because the media actually quite like it. they understand that being with the BPS is a rubber stamp of approval. But actually, people can and do display their graduate member badges, which make people think that means more than it does. So even when you see a badge, don't be afraid to ask what that means and to dig a little deeper. And that's what the book goes into, really.
It's probably also worth adding that there is no requirement for a psychologist, an applied psychologist, to be a member of the BPS either.
Yeah, absolutely. Yes,
because people do sometimes mistake that.
You don't have to do that. You can choose to do that. But it is a fee-paying organisation, so I have to pay to be part of that. I have to pay to be part of the HCPC, but that is not voluntary. If I want to practice, I must be registered with the HCPC.
Good. Well, that's beginning to be a bit clearer to me, and I expect it's much clearer if I read the book. So we move on and talk about your podcast now. You do a podcast called The Aspiring Psychologist. So what's that all about?
So I set this up for younger Marianne, probably, really, when I was working in Milton Keynes Council, actually. And I was really beautifully supervised, actually, by my supervisor at the time. But she wasn't a qualified psychologist, and I didn't know any. And it wasn't my fault I didn't know any, And so I wanted to create something that gave people really interesting conversations between qualified psychologists, but also looking at people's routes to becoming qualified psychologists in the UK. And if you find yourself working in a service, even under a professionally qualified practitioner psychologist, but for whatever reason, perhaps they're overstretched, perhaps they've got a lot on their plates in work, outside of work, or perhaps they're just, not up to scratch with their CPD, but they're not giving you the time and the investment that you need to develop your skills in reflection, to develop the breadth of your knowledge. Then this is why I created the podcast, really, to compassionately support people in that, so that they feel that it's worth doing and that it can give them even sometimes just the shove in the right direction to have them continue in their journey, or to reach out to local departments, teams, people that inspire you, or to hear about how people have done things so that you can do it the same way. So it might be worth saying that when I was in the final stages of my undergraduate degree, a clinical psychologist came along and kind of stood on the stage and said, to be honest, it's really hard to become a clinical psychologist. I wouldn't bother. I'd do something different. I was like, oh, I don't want that. I want people to be informed. It's really tricky, isn't it, Naomi? You're dual registered. It's really hard, but it's worth doing, and it's worth doing well. So if you feel like you're being pulled in a direction of becoming a practitioner psychologist, you do it. You go for it. But know that it will be tricky. But actually, these things can be helpful to consider. That's why
I'd probably just like to add there, it is competitive, but obviously training places I think they doubled from when I trained in 1994 to 97. So training places have doubled since then. But I think one of the really unfortunate practices that came about because there was a bottleneck to get on training courses is that people were basically asking to work in voluntary assistant psychology positions in order to get experience, in order to be able to get an assistant psychology post and then get onto a training course. And of course that favours people who come from more privileged backgrounds, people who can afford to not be paid to work, or don't need to, perhaps they could be supported by their parents. And thankfully that practice, I think, is dying out a bit. But I think your podcast goes a long way to giving people the opportunity to get advice and hear different accounts that actually wouldn't necessarily be available widely to people who perhaps lack resources to be able to go and do an MSc and further their studies, or be able to take up unpaid positions.
Yeah, absolutely. And yeah, it is ethically implicated, isn't it? The honorary, even calling it honorary, as an honorary assistant psychologist, that makes it sound very fancy, but it's very exploitative. I actually did do an honorary post, but I did it for 10 days whilst taking annual leave from my own job. So technically, it didn't cost me any money to do, but obviously cost me annual leave. But it's a bit of a shady practice, and to see people advertising that as well. But it's just not all right, is it? And it's kind of exploitative. And often you'll see these posts. People are quite integral parts of the services where they are working, and really they ought to be being paid. Running therapy groups with honorary assistant psychologists where there's not enough staff numbers for that group to run without them. Well, they ought to be being paid. But even the fact that assistant psychologists are usually paid at band 4 or band 5 does count out a lot of different applicants from being able to have those people with children, or people that need to live independently, or people that don't have any support from their families. Working at a band 4 NHS scale is unaffordable as well, and they're both topics that have been discussed on the podcast.
Good. So can I just come back to you about the podcast? You've given us a bit more information now, but earlier, from the way you were describing it, it sounded a bit like a helpline, and I'm sure it's not that. So could you give me an example of what might happen?
Sure. So they're all recorded episodes. They're not live. I do some live content to support people at application and interview stages of their psychology career. But that is not the Aspiring Psychologist podcast. So sometimes it's episodes just with me. For example, I've got one that's coming out soon on imposter syndrome. And sometimes they're episodes with guests. So today I have recorded one with somebody who is a psychological wellbeing practitioner, qualified, but has struggled with OCD. And we're thinking about actually what is OCD and how would you begin to pursue a career when you have OCD. So some of the episodes have dual use, not just for aspiring psychologists, but it's also on YouTube. And so people that are interested in learning from a qualified psychologist about what certain presentations are. For example, I've done one on complex trauma. I've done one on stabilization strategies, bipolar. There's loads and loads of different topics that, when any of us are working in a particular area. For example, if you're working with children and young people in a CAMS service, you might not necessarily have much insight into what it's like to work with adults, and to kind of, or even to be a parent, or to try and work in a service when you're not a parent, and work with trying to support parents to improve their parenting. That's something that I really struggle with. How am I going to get you to be a better parent when I'm not a parent myself? So one of the episodes recently was actually looking at that. How can we parent our own children better? How can we shout less? How can we be more connected? How can we empower the people working in those services to be able to do this job better, even if they're not parents themselves? There's a little bit of an overview of some of the episodes, but I think we're about 150 episodes in as I record this, so there's been quite a few.
Brilliant, thank you.
But you are exceptionally industrious, Marianne, I think, and you've just published another book so 2 books this year, I think. Do you want to tell us a bit about the second book and why the theme is so important to you?
Yeah, so this one's called An Autistic Anthology, Neuro Narratives of Mental Health Professionals. So that is with my colleagues Nikita Shepherdson, who is a trainee psychologist herself, and Dr. Vicky Jervis, and we're the editors there. So Nikita is a first-year trainee psychologist, and she was diagnosed with autism. She was actually a guest on the podcast, talking about her experiences in getting on the doctorate in what we described as record time. She was quite a young applicant, but Dr. Vicky Jervis has an autistic diagnosis herself, and I was brought on board primarily from my experiences in curating and collating collective books and getting those published. But this is a collection of 25 real life accounts from people with autism diagnosis. I think one of the stories is actually someone that understands themselves within an autistic framework but doesn't have a diagnosis. And it's thinking about their experience of getting diagnosed, but also their experiences of navigating working with the mental health patients and services, but also the real benefits that can bring. One of the really nice ideas in the book is actually where one of the chapter authors will say, actually, I think in every mental health service there ought to be somebody that is neurodiverse, because actually I can work with clients that other clinicians have really struggled to engage. And I think that's a really interesting idea, because our society is so neurodiverse. Doesn't it make sense that in terms of representation, not just in terms of culture, but in terms of neurodiversity, that there is a variety that makes up our staff teams. So yeah, it's been a really lovely project to be part of, and actually the NHS is getting behind it in trying to think about what neurodiversity is. And some people have been like, well, of course you can't have an autistic clinical psychologist. To that we'll say, well, why not? Why not? And actually what we know about people with autism is sometimes they've got real strengths in certain areas. And so if, for example, you are meticulous about neuropsych and really, really good at the interpretation and scoring of it, wouldn't we want you to be staffing our neuropsych service? But even in working therapeutically with clients with or without autism, people with autism can talk about masking and whether that's actually helpful for them and when it's unhelpful. And it's knowing that you can still be an excellent psychologist or nurse or even a psychiatrist in the book, an autistic psychiatrist, and not have that be everything about you, but almost have it be like a superpower, actually. So it's been a really, really eye-opening book.
Thank you. And I think one of our former guests, Melinda Buller, was a contributor to that book as well. So if you want to get a flavour of what might be in that book, do listen out for that conversation. And I look forward to reading more chapters from that book. But finally, Marianne, you obviously support younger people who are in that really high-pressured position of really being quite often quite desperate to get started in a career in clinical psychology, and then perhaps feeling really under pressure and struggling to know how to get on there. What advice would you offer listeners who want to take better care of their emotional and mental well-being?
Very, very good question. So it's not always younger people. Some of the people I've supported have been my age or older. We're very much widening that access, but our well-being is so important. I think it can be really important to think about it not being a race, not being a certain time that you need to do things. Because people often say, well, I want to become qualified before I'm 30. And I'm like, well, why? What difference does it make? Ultimately, when we're qualified, it doesn't really matter whether you're 30, whether you're 27, whether you're 29, whether you're 41, you get there when you get there. And ideally what we want for you is for you to come out the other side, not just being a nervous bag of energy, that you're just depleted and all on the floor. We want you to feel like you're ready to roll with this career, not that you're so burned out with it before you begin. So yeah, don't think about it as a race. Do think about the things that you enjoy alongside this. When I met my husband, he was like, I don't really get what do you do? What are your hobbies? And I'm like, don't know really. I like a bit of swimming and a bit of Pilates. I like spending time with my friends. And like, I think he almost thought that was a bit vacuous. Like, well, this is not something more about you. But I think because I was so passionate about my career, like I haven't necessarily got as many hobbies. Does that make me sound really, really boring? But over time, I've really learned that exercise is key to me, key to my well-being, key to my sleep. So I would say maybe find the thing. Maybe it's walks in the country. Maybe it's, working on your mindfulness, your, spending time with your children, whatever but have a way of decompressing that isn't just work focused. And so for me, that was Pilates and time with my friends, but it will look different for different people. And yeah, just be open to support and try to make sure that you've got well attuned supervisory relationships. So supervision shouldn't feel exactly like therapy, but sometimes it should feel a bit like therapy, because you need to be aware of your blind spots and be able to kind of have your vulnerabilities to explore what might be holding you back therapeutically, but might then ultimately be holding your clients back. So if you don't feel like you've got that, then it might not be your fault. Maybe it's time to move on to a different organization. And again, that's part of what my podcast is about. Again, quite a long answer to your question. I hope that kind of answers it.
Yeah, there was also some really good advice there about doing things at your own pace in your own time rather than feeling it's a race. And certainly when I trained, there was a man in his 50s, late 50s, training, which whenever anyone says to me, I think I've missed the boat, I'm too old, I remember this experience. And I know myself that I did my degree at Hull, which at the time offered a 6-year course for people who started at age 18, and that was the only place I'd applied to do psychology, so I was just on the straight degree. And I remember at the end of 3 years thinking, I wish I'd done the 6-year course, because I'd be well into my career now. But actually I definitely feel I'm a better psychologist for having had those experiences that I got in between my undergraduate degree and then starting psychology training, clinical psychology training a few years on. So really good advice. Yeah. Thank you very much for joining us today, Marianne. That's hopefully a really helpful conversation for people.
Thank you so much for inviting me on. It's been lovely chatting with you both.
Yeah, thanks very much indeed, Marianne, because it's been great hearing not just about your excellent clinical work, but clearly throughout your life you've been an exemplary contributor to our society and social fabric, actually, with the many things that you've done. So thanks a lot.
Lovely thing to say. That's going to make me cry. Thank you, David. That's really honest. It's lovely to be seen that way. So thank you. I love what I do, and I care passionately about easing the distress in my clients or in aspiring psychologists, or just generally humanity, with the media work I do. So thank you so much. That's really kind of you to say.
And we'll share a link to your book in our show notes so that anyone who is thinking about starting therapy will have some idea of where to go to get some pointers for what they need to be thinking about when they're trying to find a therapist. Hi, I'm Naomi Murphy, and this is the Locked Up Living podcast, where we talk with a wide range of people about harsh aspects of institutional life.
We also explore some of the ways to overcome them and to grow and develop. I'm David Jones. So join us every Wednesday morning, 6 o'clock UK time, for a fresh podcast.